The top 9 questions men have about Viagra are answered in this video. Even though Viagra has been around for many years, men still have many questions that need to be answered. There is no one-size-fits-all answer when it comes to Viagra because everyone's body reacts differently. Since we can't stop aging, the videos on this channel can help us have the best life possible. In today's news update I want to talk about, what are the top questions men have about Viagra? If you have any questions about this video, just call or text Healthy at 60+ at 609-410-4790. Now let's see what we have today. In this video you will find out what happens when you take too little or too much Viagra, as well as some of the possible side effects that can happen from taking this medication. But first, here is a short summary of what Viagra is and how it works. Viagra or sildenafil citrate mimics the action of nitric oxide, a chemical that controls blood flow in your penis by relaxing the smooth muscles inside your arteries. It relaxes these muscles in order to improve blood flow into your penis, which leads to an erection. The natural levels of nitric oxide decreases as we age, so this is likely the cause for reduced reaction with most people who are aged 50 years plus. Viagra does not work just on its own, it only increases response if there is enough nitric oxide present already. Question: why would Viagra not work? Most of the time Viagra will work as intended. However, there are certain cases where it won't be effective, and in these cases the person should seek medical advice to make sure there are no underlying medical conditions that could explain why Viagra is ineffective. Some medications can interfere with how Viagra works, and they're usually prescription-based. Also, if you drink alcohol or smoke cigarettes while taking the drug, it may decrease its effectiveness. It's also possible for certain foods such as food containing peanuts or grapefruit to affect its performance, so it's best not to eat those things too close to when you take it. Question: at what age do men need Viagra? Even though erectile dysfunction is more common in older men, the demand for Viagra doesn't discriminate when it comes to sexual function. About 40% of 40-year-old men in the US have erectile dysfunction. On average, most Viagra users today are in their early to mid-50s. Question: how long does 100 mg Viagra last? It lasts for 3 to 4 hours. It's helpful to know that the half-life of Viagra is only about 2 hours. In other words, it takes about 2 hours to reduce your Viagra level in your body by 50%. That means that after 3 to 4 hours, you'll have what's considered a moderate trace amount remaining, enough Viagra in your system to keep going, but not nearly as much as the peak amount at from 60 to 120 minutes after taking Viagra. Question: can you take 2 to 100 mg Viagra pills at once? It's not recommended to use more than 1 to 100 mg Viagra pill within any 24-hour period. If you're experiencing erectile dysfunction, but the problem persists even after taking a tablet of Viagra, then be sure to talk with your doctor about other options. We want to highlight that it could also be due to some other underlying problem, for example diabetes or prostate cancer, and in those cases considering an alternative might be an effective solution. Question: does chewing up Viagra work faster? It turns out that it does not work any quicker than taking the pill orally. For some people, this may be an easier way to consume the medication, but for others they may find that swallowing a pill is much easier and more natural. Chewing Viagra does not work quicker because in order for most medications to work, they need to go through a number of digestion and absorption steps before the active ingredients can be released into the bloodstream. Question: will Viagra work if you have nerve damage? Viagra works by promoting erections by a process that needs healthy nerve function and blood flow in the male sexual organs, so nerve damage can make things more difficult. For men whose nerves have been spared, the drug improves the ability to have an erection by nearly 60%, but the effectiveness drops to 20% in those with no nerves spared. There are other options for men who don't respond to Viagra, including injections and vacuum devices. Question: what are side effects of Viagra? The most common side effects of Viagra are headache, flushing, upset stomach, and visual disturbances. In rare cases, it can cause a sudden loss of hearing or difficulty in breathing. These symptoms should never be ignored. They could indicate serious problems that need to be addressed by a physician immediately. Question: what medication should you not take with Viagra? Viagra is contraindicated in patients with serious cardiac disease, those who are at risk of having or developing a heart condition, and those taking medications for pituitary disorders. Do not take Viagra if you are taking nitrate drugs, such as nitroglycerin or glyceryl trinitrate. Question: who shouldn't take Viagra? It is not safe for anyone who has a heart or liver problem to take Viagra. In addition, Viagra should be used with caution by people who have diabetes, and those with high blood pressure that are taking certain medications, such as alpha blockers and tamsulosin. Furthermore, men should avoid taking Viagra if they are already sensitive to other drugs of the mild nitrate type. Nitrates are present in some headache medicine, and it can cause low blood pressure when taken together. Anyone who abuses alcohol might also want to avoid using Viagra because there's the possibility of side effects that sometimes occurs when you drink while on medication. In conclusion, Viagra is a medication that has been designed to help men with erectile dysfunction. It helps the blood vessels in the penis relax and become wider, so more blood can flow into them when they are aroused. The drug works by stopping an enzyme called PDE5 from breaking down another chemical called cGMP, which causes smooth muscles in the walls of certain organs to relax and widen, as well as those found in your penis. But like any drug, there are some important things to know about how it works before taking a prescription for yourself. This video has given you all kinds of information about what might make Viagra not work, as well as when and why someone may need this type of treatment. Okay, that's it for this video. But just one more thing. If you have any questions about this video, just call or text Healthy at 60 Plus at 609-410-4790. Remember, there are many ways to deal with erectile dysfunction besides using Viagra. At Healthy at 60 Plus we have a preferred method called nitric oxide therapy. Click the link below this video to see a great explanation of nitric oxide therapy and how it can change your life. To be informed of new videos, just subscribe to this channel and remember to click the bell icon. To view other videos about this same topic, just click on either of these two video links. Thank you for stopping by and watching this video. Have a great day, and here's to your good health.